couple of weeks ago, everyone was very excited. We were going to do antibody tests, and then you would get an antibody passport on your phone that would say, I have gotten over COVID-19 and I am immune, at least for some period of time. And you could then hold up your phone with a green get out of jail card thing on your phone, and you could then go into an office building or a special event or run a race or whatever, because you were immune. And then we sort of went away from that because there was some confusion about immunity and how long it actually lasted. And the WHO came out saying, perhaps it's not such a good idea. However, a new study came out. Mount Sinai developed a really, really, really specific test. There's two things you measure in tests. There's the sensitivity, which is the ability to pick up tests that are positive. So if the thing you're testing is there, do you pick it up? That's called sensitivity. And specificity is, if you get a positive test, is that actually what you're looking for, or is it a cross-contamination? So we always worry about specificity here because there are lots of coronaviruses in our bodies, and if you're measuring antibodies and you measure an antibody and it's positive, you want to make sure it's not one of the other beta coronaviruses, that it's actually the SARS-CoV-2 virus. So Mount Sinai developed a test that's 99% specific, which means that only 1% of the time does the test report a positive when the person has some other types of antibodies that are causing the test to be positive. Very good test to have a 99% specificity. They tested a lot of people, both symptomatic and asymptomatic, and their test seems to show that most people develop a really strong antibody response to having gotten the virus. And what that means is that it looks like you may get some really good immunity for, I think, just a short period of time. What does that mean? A couple of months, 6 months, who knows? We don't know that yet, but it just points us a little bit more towards that. Maybe antibodies is the answer to the problem we're facing on restarting events. I'm sorry, I'm looking at my dog who's doing something in the kitchen there. Hey. Okay, sorry about that. So it looks like the Sinai antibody test, the IgG antibody test, may actually help us with trying to figure out, can we restart large social events? Can we restart? Because if you can test people with antibody and then also do the RT-PCR antigen test, you could then look and know that if you're lining up a bunch of people in a race, that everyone here is immune for the moment and nobody has a positive test. I mean, that's one possible way of figuring out if it's safe to run a race or run a festival or something. It would require lots of testing, and if you're interested, we can talk to you about it. But and right now that capability does not exist. We don't have enough testing in the United States, but it is a possible way out until we have a vaccine.